Hi, tonight we're going to talk about administrative applications and how they support the healthcare industry. I titled this Informatics for Leadership and Management because I also think this is really important for you to pay attention to if you're a leader or a manager, supervisor, have some type of leadership role. This is going to be really important for you. Well, it's important for everybody, but I want you to particularly pay attention if you're a leader or a manager. So let's talk about what health information systems are. Health information systems, they're complexes or systems that create and process data, and they also handle informatics and information and knowledge in healthcare environments. So what does that mean? That just means that health information systems help you manage your data, patient experiences, and a whole complex amount of interaction that goes on within the hospital or within the outpatient practice. I have spoken on several times about the fact that the electronic health record is only part of a greater system. And now we're going to look at that greater system and see what all is involved in it. And don't groan, okay? You need to understand this because as a BSN nurse, you will be a leader, you will be a manager and a supervisor if you choose to do so, but you will be a leader. And you need to understand that the impact of what you do in the electronic record, how that resonates throughout the entire health information system and impacts your hospital's revenue and also can impact your patient. In other words, if we're not careful about what we do in our day-to-day charting and in billing out supplies and so forth, it can have a big impact on the patient getting the coverage that they're supposed to have and can result in the patient having to pay more out-of-pocket money. So this is important for all of us. So understand that the part of the Affordable Care and Patient Protection Act included mandating a lot of the things that we now see in our health information systems. And so these are things that are not going to go away. And I added this slide. I didn't actually, but I wanted to talk to you about the fact, because when I do this face-to-face, I draw this on a board. So I'm just doing this here. Understand that our healthcare information systems have two parts, main divisions to them, and we don't always see the other sides regardless of where you are. So on the clinical side, you have the electronic health tech record, and you have the order entry system. In the administrative side, you have the financial part, the practice management part, the materials management part. You have and you also have HR, and you also have your business and business intelligence system, and you may have a few other things as well. But I want you to understand that these things all talk to each other. They cross each other, and they all affect each other, even when I misspell them. There we go. So the first system we want to talk about are the basic financial systems. And this basically allows the hospital to bill. It allows the hospital to pay you, which is nice. It also manages claims. It will send out claims and it will receive claims back, and it will bill and it will receive money back. It also has to have a way to handle all the denials that happen. Many, many times claims are sent out and they're denied. And a lot of times they can be denied because we on the clinical side didn't do our part in all of our documentation. So there's nothing supporting the fact that the patient is billing for all these supplies because we as nurses never documented it. And it can also be because the provider didn't code things correctly. It can also be because of, well, it can be from a number of things. But as far as the claims and so forth go, there's a very deep complexity into putting in provider information. There's things like TIN codes and tax provider information and so on and so forth. And it gets very complicated. And this is the financial information system architecture. And you can see you have customers and suppliers and business transactions, and the internet can get in place, and then you have business transactions that go across the internet, and then sometimes people come in and make payments, or there's other things that go on within the system. And then you have to have a transaction processing system. And boy, when that goes down, we have a lot of problems because your claims don't get taken care of. People can't pay their bills. You can't pay your vendors, and it becomes a big problem. So you also have all types of databases because you have to back those systems up. That was in one of our chapters last week about the fact that you have to have some redundancy in your records, and these things have to be backed up because if we lose all of this, we are in a lot of trouble. And then we have financial statements and how the funds are used and our statistics that we're going to share. And then we have our application database. And we should have some type of financial expert system. And we should have a decision support system helping to handle our database. So remember, this is just one part of the health information system. And so we have this financial system not only does all of the things that we talked about as far as processing claims and so forth, it also issues certain reports that are required by our healthcare organizations. It also has bolt-ons. These are other types of software that can be added on or hardware that can be integrated into the system. We also manage the revenue cycle. There are times within the time frame of or the life cycle where hospitals know that they're going to have more expenditure and they're going to have less patients. Think about at work the times that you have fewer patients or the times that there are fewer surgeries and so forth. All of these can impact the revenue cycle. And then we also we want that system to have some efficiency tools, some things that will help you be very productive, and also the reporting tools so that you don't have to go in there and do all of this by hand. Now you can just click a few buttons and you get all sorts of reports and sheets and information. Just a couple of things that I want you to know, and you're going to learn more about these in financial management if you take that in Summer B. But this is the income statement of the hospital, and you can see the revenue is here, the cost of goods sold, how much did it cost to provide all of that care. You have your gross margin, your overhead. What was your light bill? You know, think about your own light bill. Then think about your light bill of your hospital. It's going to be a lot more. Your normal income, your interest expense. This is how much you're spending, paying interest on capital loans and so forth. And then interest income. So that's income that you receive. Oops. And so forth. So all of this goes together to form your income statement. Then you have a balance sheet. A balance sheet shows your assets and your liabilities. So these are all the things that you have on hand. And then these are the things that are claimed against your assets. So these are your liabilities. You might have a long-term note on the building, or maybe you just remodeled and added some new equipment or redid your surgical suite, and those will be long-term notes. Your cash flow, this is showing how where all of the money went. Where did it go to? And what came in. So that's the financial system. Another system that we have on the administrative side are practice management systems. This is your ambulatory care. Some hospitals or some big organizations have an inpatient side and an ambulatory side, And so they may have this integrated into their whole system, or this could be a standalone system at the physician or provider's office. And in the system, you have the patient record, you have the master person index. This is every single patient that they see. And it also has the electronic health record. And this is the electronic health record of the clinic type visits or the outpatient surgery. So there's also a patient outreach system, and this system may be something that automatically sends a text message or an email or even an automated phone call when it's time for your appointment. It may ask you to confirm the appointment. It may tell the patient it's time for you to make an appointment, so that outreach system does other things. You also have an online billing and payment tool. You may have gotten statements from your provider and they have a link on there to go and you can pay your claim. It can also will also provide the billing at point of service. So you go up and you say, I'm here to see Dr. So-and-so, and they say your copay today is going to be $20. The system helps them know that and will receive that and then do the follow-up billing after the visit, because you may have to have something more complex than you were expecting, and so you would need more billing. It also will have a hospital physician connection, and it can link records back and forth from the provider to the hospital, and it can also do other things. And it's important to know what the providers want in that system before you set it up. All right, the next big link in the chain is the material management. This is your healthcare supply chain. Your material management is involved in linking the storage and tracking the inventory, quality control, and the operational management of supplies, other equipment, pharmaceuticals, and so forth that are used in your patient care. So your computer system should have a supply item master file. When you go to your supply room, your supply room machine that will allow you to get tape or dressing supplies or what have you out of the system, you may have to go in there and scroll, or maybe you put an A or a B for whatever you're looking for, and then there's a whole list. So this supply item master file includes everything, every type of supply that the hospital has. So you may not get that full list when you're accessing it at that point, but somewhere in your facility, there's someone who is in charge of that and has a list of absolutely everything that gets ordered. And then there's a charge description master file, and this shows the cost of everything that's used up. So it will have a list saying how much each 4x4, how much a tegaderm is, how much your catheter kit is, and so forth. And so that's the basis of how that's billed. Now the vendor master file is the file of every single supplier to the hospital. So everybody that's providing stuff to the hospital is there. And then your transaction history file is every charge that's made, every charge, and that is what goes and links up with the claims and the billing. And this is a picture of your supply. And see, this is your inventory. It says how many are on hand, how many are on order, and then it talks about packaging and so forth. So this is just an example of that. So the supply charge capture, this is what integrates. This is one of the places where the whole health information system and the clinic side and the administrative side meet together. This is one of those places where they have to interact correctly so that the supply gets billed to the right patient, and then the patient will show that, yes, they use the supply, and so this will meet the demands for the claim. And so it's got to be efficient. It's also got to be something that has a good human machine interface. In other words, it's got to be easy for you to use. If it breaks down or crashes, or if it's not easy for you to find information, then that can inhibit you from using it. And you need to be sure and let your IT people know that that's a problem. And if you're the IT person, then make sure it's not a problem. Also, so you need to look at what factors are associated with supply, success, and enhancement. So the leadership needs to have someone with supply chain expertise. You need to have collaborations from the providers, and it needs to be usable for nurses, and the nurses need to be able to access it and use it quickly. Some other considerations: the nursing unit needs and the physician needs or provider needs, those need to be addressed. The physical layout of where all the supplies are may need to be changed or modified to make it accessible to everyone. You don't want it down at the end and around the corner of the hall. It needs to be someplace where it can be accessed. And the business part of the process has to be solved before you can put it into the IT system. So you've got to have a system in place and understand how your billing works and how all of this is going to happen. So you've got to map out where all of this needs to go. What does this need to look like? So here we have where the patient is used it, the nurse has drawn it out of the machine, and the charge has been filed. Where does that need to go? All of that needs to be mapped out so that it can be programmed correctly. Next in our set of systems on the administrative side is your HR system. And this is the system that is going to work with policies and procedures. It can even hold all of the job descriptions, the hiring, all of that can be in there. Pay, benefits, vacation, insurance, all of those things can be accessible and work together for the HR system. Some places have this. If you are the manager, then you go in there and you can find your employees' information as far as when have they had a vacation, how many sick days do they have left. You may be required to put in that sick time or that vacation time in order for it to be tracked. It also may house your performance evaluation. And a lot of the bigger places now, the employee you'll get an email or a message through your employment system, and it will, when you log on, it'll say, hey, it's time for you to fill out your part of the performance appraisal form, and you'll go and you'll rate yourself on how you think you did, and you'll go in and provide support for what you did. By the way, this is when it's really, really important to have what I call a love me book, just a notebook, and write down every amazing thing that you did. Anytime anyone sends you an email and says, wow, you did a great job, or a patient has sent you a card, or you've gotten some kind of kudos, keep all of that. You are your best press agent. So be sure you keep all of that, because then you can pull that up and put all of that in when it's time for your performance review. Likewise, if you're a manager, you want to keep track of the good things that your employees did and maybe the things that you have concerns about, so that you have evidence for what you want to say. This system can also link into the time clock, so it can record hours worked and so on and so forth. It may have all of your tax information, your withholdings, all of that may be linked in. Now, your vendors are a different group from your supply chain. Your supply chain is what you do, how you order the materials, and where it's going to go once it arrives at your institution. Your vendors are the people that are going to supply you with things. So it could be your vendor who takes care of your HR, your hiring. They may process all of the applications. It could be someone who provides different uh, supplies like your surgical supplies and so forth, but there are also vendors of our health information systems. And a lot of times the human resource system is not found within the regular health information system. It's what we call a bolt-on. So it may be a system that's separate from everything else. And I included some links here that you can click on and look at some of these different places that provide vendors, and they have some things that you can look at and see. The other thing that your human resource information will do is your personnel, and then also can look at your strategic and operational management, your staffing and scheduling. This may be the system that determines how many people that you need. If you have an open shift unit where you all kind of work together and put in when you want to work and what shifts you want to work, that can be handled on this. It can also do predictive scheduling based on what you normally see at this day of the week or this time of the year. It's also can run your training and development. Do you log on sometimes and it says, hey, it's time for you to do your HIPAA module again, or it's time for you to do your annual safety module again. So it can do that. I already talked about compensation and so forth, and I think I mentioned that payroll is in that. That's really important because we all like to get paid. And then you can have some systems that aren't very well tracked within human resource systems, and that's the labor relations. That's like job satisfaction, complaints, problems. Oftentimes there's not really a formal way for people to file a complaint, and so they have to go into HR and write something out. The newer systems handle expenses and travel, so you can put in your expenses if you had to go to a seminar or you had to travel somewhere for work for whatever, and then you can put in your expenses and upload your receipts and so forth, and it's very nice. Your business intelligence systems, this is how you acquire and manage and transform data. In other words, the raw data that's being collected into something that everyone can use. So this is where all the numbers get crunched, and then we find out, okay, from this information we know how many people to staff, or we can project what our earnings are going to be this quarter. And so it helps them make better decisions about things like, this is going to be the year when we can go ahead and add on 50 beds to our hospital, or this is going to be the year when we really need to cut back on staff. So this helps you figure that out. And it's best described like a stack of information. And it starts with the hardware and the operating system, and then how data comes in, and how data is integrated. How are all these systems put in together? And then where's the data going to go, and where are we going to store it? How is the data going to be analyzed? And then the important part, this is that human-machine interface. How are we going to interact with it and work with it? So there are professionals that do that. And so some of the initiatives that drive our health information systems, first of all, we had a federal health information technology strategic plan, and this is what kind of drove the building of our current system that we have now. These were the strategic goals. In 2011 and 12, we really started capturing data, and then we began having a more access and more use of it. And then in 2015 and beyond, we've worked on making it better, making it more transparent, in some cases allowing patients to put in their information. And we've also added population health and public health to this system. So we've looked at also using this to identify quality and patient safety issues. and things like medication safety, your clinical decision systems that say, no, don't give that, or you need to record the apical pulse before you give your digoxin, or have another nurse verify your insulin dosage, and so on. And this just shows the framework for that quality research design, and you can look through that. And we want to have quality as part of the whole health information system. We want to be able to track all of those outcomes that we're required to track for reaccreditation and for certification. And it helps us also go back and look at sentinel events and other problems and see where they happened, and gives us an opportunity to track it backwards. And understand there's a continuum of quality and safety. And so we need to look at the causes and the immediacy. Now, how important is this? Where is this on the urgency side? And then where is this on how bad the problem will see side? So this kind of helps us to track where they are. Some of the things that we've done to improve medications safety have included the physician order entry, and that's been really big. I don't know how long you've been a nurse. I've been a nurse almost 32 years, and I can remember us all gathering around trying to figure out what Dr. so-and-so really meant, because everyone was terrified of calling him because he would get mad and complain and get people fired and so on. Now, all of that has changed now, and with laws and so forth, so they have to write things that are legible, and now we have the computer order entry system, and that's made a lot of things better. And this will alert the physician if they've ordered a dose that's unsafe or a medication that can interact. So it'll give up a warning. You know what? Spironolactone will increase your potassium level, so will your ACE inhibitors, and so do you really want to give those together? So it just pops up and says, and gives them an alert so that they don't order something by mistake. Also, it provides the MAR, the electronic MAR, which is much better than the book that we would all try to write in. And then the barcode that integrates. So you scan the medication, scan the patient, it's all recorded. And as long as you actually gave it when you scanned it, then everything works out well. Also, this can also help with your chronic illness screening. Also deals with certain outcomes like falls and pressure ulcers. As of 2006, we had the Deficit Reduction Act that says CMS, that's Center for Medicaid and Medicare Services, decided we're not going to pay for it when hospitals cause someone to have a fall, or if somebody develops a pressure ulcer and other things that could be prevented. So it also tracks our success factors and looks at the things that are helped and supported by IT, and that's both on the management side and the clinical side. So it can look at how many days you went without an accident, or how many patients were admitted and discharged within the time that was expected or allotted for that particular disease. So we also know that we need to work with our stakeholders to get support, and that these interventions will help provide adherence with all of the things that we need for reaccreditation and all of our standards and criteria for patient and safety care. And this framework basically refers back here to this quality and safety continuum. So where did we go? There we are. And through our healthcare information system, we can track our implementation, the performance management, and also research projects. And so we need to know that we've learned a lot from doing this. This is helping to stop some errors. It's not eliminating all of them. And so we have more things that we need to do to make it better. And we also need to look at what our system is doing on quality. Is our quality improving? Are we analyzing data correctly? Are we doing everything we need to do? Are there more indicators, more problems, more items that our health information system could be tracking to help us track more of these and improve our quality?